Good morning. I will be talking about dentin bonding agents. So what is the importance of bonding? So basically, bonding techniques allow more conservative tooth preparation. We have less reliance on micromechanical retention methods such as giving convergence, undercuts, mechanical interlock, etc. in case of a non-adhesive respiratory material such as amalgam. So basically, if we adopt adhesive dentistry, we can conserve more tooth structure. So in respiratory dentistry, mainly we have to deal with two tissues, enamel and dentin. Both are different in structure and in histologically it is different. While enamel have more inorganic content, dentin will be having more organic content. So definitely bonding will be more difficult in dentin when compared to enamel. So how bonding to enamel or dentin is possible? It is by first we have to create some microporosities by means of etching, and we have to infiltrate that microporosities by using something called as a primer, and we have a adhesive. So primer is nothing but an adhesion promoting agent. Adhesive is nothing but an unfilled resin. So etching is done by using mainly organic acid. Can be either a separate step or it can be incorporated in the adhesive system. It can be either washed off, or if it is incorporated in adhesive system, there is no need for a separate washing step. Primer is nothing. It is basically adhesion promoter. So it will have two ends, hydrophobic and hydrophilic ends. Hydrophobic end to bond with composite and hydrophilic end to bond with dentin. And usually it is carried in a solvent. And adhesive is nothing but an unfilled resin such as a BIS-GMA, TEC-DMA or UDMA. So there basically there are different types of classification, such as according to chemical composition, according to mode of action, according to bond strength, etc., etc. But for our most widely accepted classification is according to generation and according to how it deals with the smear layer and some current classification and recommendations. So classification based on generation, it is classified from first to 8 generations. The first 3 generations were experimental and it is obsolete today. So the real game changer in adhesive dentistry came from the 4th generation. Here they completely remove the smear layer and it is considered as the golden standard in the dentin bonding. In this generation, we have 3 components, etchant, primer and a adhesive, and it is packaged in 3 separate containers. So in one bottle we will have etchant, second bottle we will have primer, and in third bottle we will have the adhesive. So the concept of totlets technique and most dentin bonding were the hallmarks of the 4th generation. But by removing the smear layer, it causes post-operative sensitivity, and it was very technique sensitive because we have 3 separate steps. The isolation was of paramount importance. There was no standardization, so the manufacturers simplified, and then came the 5th generation. So what they have done is they have combined the primer and adhesive into one solution to be applied on enamel and dentin simultaneously. So here we need a separate etching step, and they combined primer and adhesive into a single bottle. So from 3 bottles to 2 bottles. 6th generation, to further simplify, the 6th generation were introduced. They were also known as self-etching primers. So we have 2 types. We have 2 bottles. We have 2 bottles. One step, 2 bottle, 1 step. We have 2 bottle, 2 step technique and 2 bottle, 1 step. In 2 bottle, 2 step technique, we had 2 step. One in first one we have etchant and primer together, adhesive in a separate step. Otherwise, we have to mix the components of the 2 bottles and we can apply once. That is 2 bottle single step. In 7th generation, to further simplify, etchant, primer and adhesive all were incorporated into a single bottle. That is called as all-in-one. In some journals, there is something called as a 8th generation bonding agent. It contains nano-sized fillers. Modern strategies or classification include, depending upon the adhesive strategies. It can be either etch and rinse. In etch and rinse, we have a separate etching steps. We have to apply first the acid and we have to rinse off. In this, we have 3-step and 2-step. 3-step is 4th generation, 2-step is 6th generation. Sorry, 5th generation. And in self-etch, there is no separate etchant. We have the 6th generation. We have 2-step etchant and primer in 1 step. There is no need for rinsing. After curing, you have to apply the adhesive. 1 step, a single bottle solution, and self-etch 2-step single bottle technique. And we have universal. Universal means you can use in multi-modes. Either you can use in the etch and rinse technique or you can use in self-etch. This is Van Meerbeek's classification. Basically, it is etch and rinse, self-etch, and resin modified glass ionomer adhesive. Etch and rinse means we will have a separate etching step and a rinsing step. Self-etch, in this mild acids were incorporated in the primer. Universal adhesive, nothing but a multi-mode. It can be used as self-etch or it can be used as in a etch and rinse mode. So the universal adhesives have much broader application than several 7th generation system. It can be used for cementing indirect restoration also. So the current recommendation, the micromechanical interlocking is still the best strategy to bond to enamel. In case of Dentin, selective phosphoric acid etching of the enamel before applying, if the cavity is in the dentin, you have to go for a selective etching. That means selective phosphoric acid etching of the enamel cavity followed by a mild self-etch to the dentin. And such mild self-etch should contain functional monomers with high chemical affinity to hydroxyapatite. Phosphoric acid etching of dentin is considered now considered too aggressive for dentin, given all the consequences related to exposure of the vulnerable collagen. So to conclude, adhesive dentistry has revolutionized restorative dental practice. Improved adhesive materials have made resin-based composite restoration more reliable and long-standing. Thank you.